Could you solve your health issues just by breathing properly? Let's find out. All right, so breathing, pretty amazing thing. Actually, if you think about breathing, whether we think about it or not, we continue to breathe every day of the week, all day long. But if you think about it also, breathing is one of the things that innately just occurs, automatically occurs, whether we try to, but we can influence it. It is both a subconscious thing and a conscious thing, meaning it's one of the few things like that we can actually control in our body. I mean, you can think about your heart rate all you want, but you can't just actively say, hey, heart, beat faster, heart, beat slower. You can't eat a sandwich and say, hey, gut, digest this faster, digest it slower. But with the lungs, you can say, hey, deep breath in, breathe out, breathe shallow, and it'll continue on its own even after you stop telling it what to do. So pretty amazing how it functions. But many people have issues with their breathing that relates to their health. And a lot of times we think of that in that we don't get in enough oxygen, or we don't breathe properly because of obstruction or congestion or different types of health conditions. But it turns out that you can actually solve some of these health issues by learning or training your body to breathe properly, because many of us have not been breathing properly for quite some time. And especially if you have chronic health issues, autoimmune issues, different conditions, usually you have not been breathing properly. And that can be something that can be so helpful to getting your help for your condition. So let's talk more about that. And really, as these nerves come out of your brain, because again, our brain really controls everything, these nerves go down your brainstem, they exit out in your neck, at the third, fourth, and fifth cervical vertebrae in your neck, and then they go down to the diaphragm and affect our breathing. And so we not only have our diaphragm, which is a muscle at the bottom of our rib cage above our stomach, that is a muscle that causes our lungs to expand, increase intake of air when we contract it. But also we have what are called intercostal muscles. Between all of our ribs, there's muscles. We don't even think about that usually, but these muscles also expand and contract that affect our breathing. Our breathing, of course, comes in through our nose and our mouth. We'll talk more about that. And then goes, of course, down the trachea and through our bronchi and bronchial tubes into these little sacs of fluid called alveoli, which are really pretty amazing, because instead of just having a lung, like a big bag full of air, you got all these little tiny little bags in there, and that increases the surface area of the lung, so we can get so much more into our system as we breathe in and breathe out. It's really pretty amazingly created there. So the thing about it, though, is it's often thought, and I remember even in early science, I was taught that, hey, CO2 is a waste product. You need oxygen, get that CO2 out of there, when it turns out that that wasn't true at all. We actually need carbon dioxide. It's extremely important to breathing and function. It actually has different jobs in the body. But the thing that we found out, which is called, I won't get into the details of the Bohr-Haldane effect, is that basically you have to have carbon dioxide for oxygen to release from your red blood cells. Very important. In order for it to disassociate or release, gotta have carbon dioxide. So our level of carbon dioxide in our body, in our lungs, is actually very important. It's not more or less, it's a balance, and a correct balance. So we want to do things that help keep that balance properly. When we think of carbon dioxide and oxygen, actually, if that balance is off, let's say someone went into a panic. If you'll notice, they're breathing really quickly. What's happening? They're off-gassing CO2 too fast. So actually the balance goes off. Now we have too much oxygen, not enough CO2. So now we can't release oxygen to our brain. We're hyperventilating. And that, of course, makes the anxiety even worse. So the thing is what do they have you do? Hey, take a paper bag, breathe in and out. So now you're breathing in more carbon dioxide to rebalance things. And now you can get rid of that oxygen by using CO2. Now you're getting oxygen to your brain. So kind of interesting effect. So the thing is there's a doctor, I think it was Boteko, which he's actually from the Ukraine. And during the 1950s, he developed a method of figuring out, hey, Are you keeping this balance of oxygen to carbon dioxide level? And how can we find out? And what can we do to improve it? So we're going to go over some things with the Buteyko, if I'm saying that correctly, breathing method, which is called the control pause, which the control pause is really kind of the test to find out, if you are breathing correctly. We got to find out the test, see how you're doing, and then we can tell you what to do about it. So what happens if you're not breathing right? And what did this doctor say? He said, hey, if you're not breathing right, anxiety, stress, panic, ADHD, asthma, rhinitis, hay fever, dental health issues, craniofacial development. Actually, it's been found that people who are nose breathers versus mouth breathers, their face develops differently, much healthier to breathe through your nose. And then insomnia, snoring. Many people who have sleep apnea, they can very much so benefit from this. They're not just condemned to the life of wearing a CPAP every day. And that's both types of sleep apnea, central and obstructive. And then just chronic health issues. So it's like, wow, wait a second, we can help these types of issues by just breathing properly? Absolutely. So I want you to try this control pause method. I want you to learn how to do this, and then you can kind of decide or figure out, hey, am I breathing properly? What's going on here? So the first thing you're going to do is you need to get a stopwatch. You don't even have to use your phone. Go into the area where the alarm is, and usually there's a little stopwatch setting. If you don't have a phone that has a stopwatch, then you're going to need to use a watch or a clock, something with a second hand. Because what we're going to do is we're going to see how you do over a little period of time here, which really maybe as long as it goes up to 60 seconds. Okay, so first thing you're going to do is think about, hey, I'm just going to sit in this chair, or you could do this standing, but make sure your posture is pretty decent there. And you're just going to breathe normally, as if you're breathing normally right now, just normal inhale, normal exhale. This isn't a test where you're going to take really deep breaths and breathe out a lot. No, this is just to check where you're at on a normal daily basis when you're not really thinking about your breathing too much. So what you're going to do is you're going to take a small, relaxed breath of air in and out. That's all you're going to do to start with. Go ahead and just take the breath out normally. Breathe in, just normal. Breath in, hold the nose. Now, of course, I'm not holding them. I'm breathing right now because I'm talking. I got to talk. All right. And so what you're going to do is just hold that. And I want you to hold it until you feel just the first sign of air hunger, meaning that you feel like, oh, I need to breathe, or it's actually going to make me breathe deeper when I stop. That is actually your control pause. That is where your level is. So again, you can do that. Watch the clock. So I'm going to see how long I go before I feel that. You don't even have to watch the clock. I would say as soon as you do that, look down at the clock. That way you're not feeling like, hey, I'm trying to make this go longer just by holding it longer. Because the thing you don't want to happen is, hey, I did that, and then I had to take this big gasp of air afterwards because I just depleted everything so much. No, that's an improper test. You need to relax, do it again, and just again, relax, breath out, relax, breath in, hold your nose, and just kind of wait until you feel like, hey, I need to take a breath, and then it should just be a normal breath in. So that's the way that should occur. Now you've timed yourself. You've done this. Let's say you could only go 5 seconds, 10 seconds, 20 seconds. Well, we're going to talk about that here in a second. And then, of course, after you get done, do release your nose. All right, so what are the results of this? Okay, if you're less than 20 seconds, that's a problem. You should easily, really the human body should easily be able to hold your breath just normally for about 30 seconds without it being traumatic, like, I've really got to take that big deep breath in afterwards. So you should easily be able to go 30 seconds. So when you're less than 20 seconds, usually we're going to find out you're symptomatic, you have health issues. You might notice, or others might notice, that they can hear you breathing on a regular basis. Your breathing looks labored. You're having breathing issues on a regular basis and a lot of other health issues. So we need to figure out, how do we improve this? If you found yourself, hey, I got between 20 to 40, good job. That's great. You're on your way. That's what we would like to see. That means you definitely have less symptoms. You're doing better. But if you hit that greater than, if you hit 40 seconds, if you're like 40 seconds, or you got more than 40 seconds, which I'm doubting it. But if you did, amazing. You've already been probably doing this for a while, or some other type of breathing exercise, or maybe you do other things to help with your oxygen CO2 ratios. But again, if you can't hold if you find that, hey, I can't do this, then your CO2 oxygen levels are incorrect. We already know this. So the thing that you'll do is, as you do what we're going to talk about here in a minute, you're going to find that this number increases, that you're able to hold your breath longer. And in fact, you'll find that about every increase of 5 seconds, it's going to be like, hey, this thing is really working. Now, are you going to increase by 5 seconds every day? Probably not. Maybe about 5 seconds every week might be easy. But usually it's about 3 to 4 seconds per week is what the average person will increase, which is exciting because as you continue to do this as part of your workout, you're going to find that this will start to change your health. So I think this is very important. And I put the goal on there. Once you hit 40 and you're like, hey, I'm at 40, it's getting pretty darn easy. Hold that 40 for 6 months. Kind of test yourself every once in a while using the control pause. Say, hey, am I maintaining my 40? And usually you will. You'll start to, again, this is going to reprogram your breathing. And actually can totally change health. So it is very exciting. Now, how the heck do we do this? What do we do to get there? All right, so there's a few things. Number one that I want you to start focusing on is breathing through your nose. This is critical. There are many, many advantages to breathing through your nose. And actually I have another video on that, which I'm going to talk about too here with this next one, trying mouth taping. So watch that video when you get a chance. It should be up there. And that will talk about mouth taping, but also it talks more about nose breathing. Nose breathing, nasal breathing. Gosh, this can be life-changing in itself too and has so many benefits over mouth breathing. All right, so yes, you can use taping your mouth, especially when you sleep. Works fantastically well. I put a link down below to the type of tape that I use, that I like to use, so you can always check that out on Amazon. And then also belly breathing. So when you breathe, it should not, most people when they breathe, it makes their chest expand. That's really not correct. I mean, we can do it, it can happen, but it's really not the way we want it. We want belly breathing. Actually, your abdomen should expand and contract, and that lifts and lowers your diaphragm. So belly breathing is actually very good for your rest and digest system, your parasympathetic nervous system. All right, now the other thing that you can do to improve this is adding exercise. Of course, the more you do of exercise, really, and it doesn't even always have to be like cardio type stuff. This could be just even lifting some weights or just anything that you like, but increasing the heart rate, changing breathing, this can really help with this too. Because if you're very sedentary, yeah, my bet is your control pause is really low and you're not really breathing well. If you're sitting at a desk all day, you need to counter that with physical activity to help with your breathing. Okay, so what are we going to do here? How are we going to do this? So number one, we need to inhale 5 seconds. So you're just 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. Count to yourself in your mind as you breathe in through your nose. We're going to do all this through the nose, not through the mouth. Now, if you're like, gosh, I got an issue with my nose. I have a hard time breathing in. Actually, what we found is that improves over time. So do what you can. Try it. Try to each day go a little more and more, and things can actually change. So, and then once you breathed in for the 5 seconds, again, this is just a relaxed, and just slowly count to yourself. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. And then you're going to breathe out through your nose again for 15 seconds. And again, you're just counting 1, 1,000, 2, 1,000 until you hit 15. Now, once you get towards like 10 seconds, 10, 1,000, 11, 1,000, 12, you might start to notice, hey, I'm kind of getting to the end of my exhale there. Yeah, that means, again, your CO2 is not correct. Your carbon dioxide levels are not correct. So again, don't start with 3 times of this in a row. Do it once. Do it a couple of times. Your goal, though, is to be able to do this 3 times in a row. And then if you're, hey, that's getting easier, start doing it twice a day. And what you'll find is you do this on a regular basis, you're going to find that, hey, my control pause, I'm getting better. I'm at 20 seconds, 30 seconds. Now I'm at 40 seconds here. So the thing is this will take some time. Like I said, each week you may notice, hey, I'm going up 3 to 4 seconds. Wow. Yeah, fantastic. Very, very good. And one other thing you can do too to kind of help out along the way is what they call physiological sighing. And with physiological sighing, you're going to take 2 quick inhales. So it's a big inhale, really big inhale. And see that little end one? That was your second one. So you take 1 big inhale with another little extra one. And then you'll find out, hey, that really, whoa, that kind of woke me up there. And then after you do that second quick inhale, you're going to slowly exhale and just let it out slow. And you could do that even for the 15 seconds. And you could do that one multiple times per day. But really that first exercise that I gave you is the best. You couple that with mouth taping or nose breathing, belly breathing, adding exercise, you're going to really get through this a lot faster. But I think this can be a fantastic thing for your health, something that you can do that doesn't require buying something or having a gym or anything like that. And this could benefit you way into the future, if not already pretty immediately. All right, well, hopefully everybody got some great information out of this. God bless, and I'll see you next time.